Hi, welcome to my presentation on health disparities due to socioeconomic status by Karen Last. Individuals with a low income are being underserved by the healthcare community. The targeted low-income population are racially diverse, of various ages and abilities, and often single-parent families. Diversity has affected the social practices of the healthcare system by expanding the education of medical professionals about cultural practices of all the populations it serves. Healthcare workers and educators seek to provide culturally sensitive medical practice. Health disparities due to socioeconomic barriers have shaped the medical field. It has caused a great chasm in the quality and longevity of millions of Americans. It is important to find ways to bridge the gap in quality and accessibility to healthcare in less economically stable regions of our society. Healthcare inequality negatively impacts a multitude of people in our society. Diversity in backgrounds such as educational level, income, culture, or personal beliefs can all be reasons, individually or collaboratively, for not accessing health care. Many reasons exist for individuals not to seek health care. Having a more diverse healthcare workforce would help accommodate the needs of a culturally diverse patient population. Equitable healthcare is an especially important topic because it affects the overall well-being every individual attains for the duration of their life. In the social sphere, a person is less able to work and earn money to create a better life for themselves and their families if they are sick. A person's health partially determines where the trajectory of their life will go, whether or not they can complete a term of education, and their ability to potentiate all of the dreams they have. Equitable health care among diverse populations will eventually be addressed and corrected in our society. Social change has been made to tackle the gaping hole of uninsured and underinsured with the implementation of the Affordable Care Act. A study showed that inequalities in mortality from health conditions are often substantial and contribute between 11 and 24% to inequalities in partial life expectancy between the ages of 30 and 64. This shows that inequality in healthcare directly correlates to negative and even fatal patient outcomes. Strategies that can be used to correct the problem of healthcare inequalities are to first create a public health campaign through a government-funded initiative. This will help to identify healthcare disparities as an issue within our society, using advertisement on public transportation, such as many public health campaigns have used in the past. Once people realize that accessing healthcare will improve the life expectancy of all our diverse populations, they may self-identify and take the initiative to seek a primary care doctor for an initial assessment. Although people are aware that education affects many life domains, such as housing, income, access to health care, fewer are aware that education also affects health. Knowing where to go to get resources or who to talk to is often not known and can be directly spoken about at the doctor's office. Data needs to be collected that identifies and assesses the population and problem of diversity in relation to health outcomes. The responsible issues contributing to the cause of healthcare disparities needs to be analyzed and identified. Then, a plan needs to be created and implemented to overcome the issue of inequitable healthcare. A key goal of Healthy People 2020 is to eliminate health disparities because overwhelming evidence indicates that disparities in health by race, socioeconomic status, and other demographic and social factors are large and persistent in the United States. The benefit of having a local health service organization or a hospital extend community outreach efforts would help residents due to the limited access to transportation that many low-income residents have. Community outreach programs to identify populations in need of care are a gateway to bring people back into regular health screenings. Social services that offer transportation to the underserved populations can be utilized for service. This is important because regular health screenings are key to early detection and prevention of health issues. How can we help reduce current and future health inequalities? There are 6 key areas where intervention can help reduce inequalities: socioeconomic conditions, social and physical environments, access to quality health care, cultural competence, health literacy, and empowered healthcare consumers. These interventions can help us reach our goal of equitable health care. Healthcare inequality in a diverse population of low-income individuals are caused by social determinants of health. Social determinants of health are factors such as economic status, education, environmental factors, nutrition, stress, and prejudice that led to resource constraints, poor health, and health risks.